joining us on Facebook. Thank you for joining us on Twitter and on cbsnews.com. I asked the governor earlier today, you know, one of the things I don't like about broadcast television is the limited amount of time we have to provide context and depth to the story. And so the governor has always been amenable to spending some time to provide as much of that as possible. So we're doing that tonight. Thank you, sir.
Thank you.
Number one, you accept the death toll.
Yes.
You officially raised it.
Right.
To 2,975. You announced the creation of a commission.
Yep.
The commission will have, as I'm told, maybe 8 members, maybe more than that.
Yeah, we're
who's going to be on it?
Well, from the government side, it'll be, you know, Secretary of Health, Secretary of Public Health, Public Safety, you know, vital statistics, and amongst others that are critical for the initial public health and safety response. We want to get some private sector folks, you know, or non-government folks in as well, at least as the first phase. We're really going to focus right now on you know, the healthcare or the public health actions, but towards the future, we really want to expand this 920 commission for other aspects.
Are you going to have experts, like people?
Yes.
Who, part of what George Washington detailed in their report was the lack of expertise. Mm-hmm. So on your commission, will you have experts in disaster management and mortality certification?
That's the aspiration, of course.
Okay.
We need to identify some of these experts, and we need to have counterparts from the government and from you know, from non-government, so that we can actually implement what their recommendations are. My expectation again is to get this sort of primed and going, so that we can start landing some of the recommendations that not only George Washington made, but really there's been a whole host of recommendations, and what we really want to do is get them to the ground, make sure that they're executable. Right now, some of the recommendations are good, but they're really high level. So it's
detail what you mean by that.
So many of the recommendations are things such as you have to revise protocols to respond more effectively. Okay, so let's get a commission to detail what that means.
Right. Like, what does that mean?
Right. You need to create an interagency effort so that they can respond and be connected continuously in case of another event. So which of these agencies are we going to use? Who are going to be the folks from those agencies that are going to be the point persons? That's the sort of thing I think needs to be ironed out. And of course, executing some other petitions. As you know, I proposed the idea of creating a census so that we can identify folks that are on dialysis, folks that have diabetes or have chronic ills, the elderly, and people that are in by GIS in areas that are in danger, so that we can respond to them in a different way.
Let me just ask a follow-up to the point you make about sort of monitoring the most critically ill. Why is that only now happening a year after the storm? Like, why wasn't that done sooner?
Monitoring, we're not even talking about monitoring, and this is important. We're talking about creating a census, so we just identify them first.
Why wasn't that done sooner?
Right. Well, after the storm, we've been creating and looking for alternatives to do that. The truth of the matter is there is a severe lack of visibility in terms of properties in Puerto Rico. So, for example, we needed to get one of the things that we're doing right now with the funding that's coming in this first set is getting a GIS map of Puerto Rico, of all of the properties and all the folks therein, so that we can respond better in emergencies. Right after the storm, we didn't have visibility of maybe 30 or 40% of the properties in Puerto Rico. So emergency first respondents didn't even know where some of these homes were. So it is important for us to have a baseline, a category, and a record of all of the folks in Puerto Rico, all of the properties, and if there are special needs to all of these things. Why wasn't it done sooner? We've been creating platforms to establish it. The truth of the matter is, when I came to office, Puerto Rico lacked a lot of things that you might assume are already inherent in other states, such as I'll give you an example. We didn't have an integrated financial system in Puerto Rico or platform, human resources platform in Puerto Rico for government. And by the same token, we didn't have sort of an integrated map of properties and where people were. All of these things we've been now trying to work on our digital reform so that we can get visibility and execute properly.
And to that point, the governor, it's worth pointing out what the governor's alluding to about not having what other places have. The George Washington University report was detailed in saying that physicians didn't have the proper training to certify deaths as being storm-related, and some physicians were actually worried about classifying a death as storm-related because it may bring on a lawsuit in the future. And so the physicians admitted to not being trained, and the government didn't, the government, people who were interviewed from the government said that they didn't have the training, like the government didn't have the people. So here's a question I have for you. Mr. Pesquera said to me so many times, I rely on the doctors to tell me when a death should be storm-related. Now we know that the doctors didn't even know how to do the process. Yep. My question is, number one, why was Mr. Pesquera the point man for answering questions about death certifications? It's not his experience level or expertise.
Right. Well, the reason was that under the new public safety department that we have, there are some components that deal with that. Number two, Mr. Pesquera already had experience in storm-related events with Andrew, so that was very important for me. And number three, I named him state coordinator. So he was one of the, in a circumstance like this that really didn't have any other precedent, he was one of the folks that actually had experienced something on a lower level, but similar to Maria. So for us, it was important. I trusted his leadership. I trusted him to work on finding out what were some of the limitations that we had to get these numbers and to get the proper assessment. And of course, it reached a point where we figured out that the method that we were using was just not appropriate.
Do you now think that he was the wrong front man, so to speak, on that issue?
Well, in that moment in time, I think he was the right man, and the main reason is he had the wherewithal to understand what was occurring. Some other folks didn't have that experience, and really what we're talking about here is the fact that this situation about the doctors, for example, yes, nobody really knew about it. So even if you were to have brought in the experts, people, even with the experts, people you would still probably have that lingering problem.
But in hindsight, do you recognize that he was not the right person?
Well, if we had, let's say, somebody of epidemiological expertise that had gone through these processes, then sure, going towards the future, we might put that person as a front man for this particular scenario. Truth of the matter is that Maria was unprecedented on its devastation, and the preparation that we had really, I turned it back that it was really to a Cat 1, Cat 2 hurricane.
And I get that. Listen, I've said early on, the governor had been in office for 8 months. The government's plan, which existed before the governor came in, was woefully underprepared and inept in many ways. But I guess my only reason for focusing on Mr. Pesquera is because for so long we would press him on the death toll, and he pushed back so hard that we were asking the wrong questions. We were not listening to what he was saying. He knew what was best and that kind of. And listen, I respect the man. He's never shied away from a question. But he was misleading us and giving us the wrong information. And well, now the study...
I don't think that's fair. I don't think that's fair. I don't think that's fair at all. I think he did have the wrong information because it was insufficient. He wasn't misleading. Misleading denotes intent. And he had no intent to mislead. The only thing he could have, and partially because he didn't have that expertise, right? Partially because really nobody had gone through this sort of devastation at this level, was what the doctors would get him. It was based on a CDC protocol that, again, was demonstrated right now to be insufficient. So were the numbers wrong? Of course they were wrong. Was it an intentional mislead? Of course it wasn't.
Okay. All right. Fair enough. I just remember so many times asking him about it and just getting pummeled about, no, that's not true, and why are you asking that? Because I'm telling you the process and all this kind of.
Well,
the process was
flawed. Yeah,
flawed.
But he didn't know it was flawed, right? And again, as we started seeing the numbers, and as we started having experiences going around Puerto Rico, we saw that there was something that was not adding up, and that's when we decided to stop. The man executed a protocol based on the CDC, right? It's not something that he made up.
Well, why didn't somebody from the CDC come and work? Like, again, Mr. Pesquero worked for the FBI. He's got a ton of experience. But why wasn't somebody from the CDC here speaking on behalf of you?
Well, again, we didn't have that CDC person over here, and this is all occurring amidst the devastation. I am trying to get a person that I think within the protocol that was there has the administrative wherewithal, has the commitment to tell the truth, had gone through the experience. And therefore, I thought it was opportune for him to do it. I am sure that he would be the first, had we had somebody similar to him, but with expertise on the storm-related healthcare side. There, he would have gladly stepped aside and let him do it, because he was already being the state coordinator.
You talk about traveling around Puerto Rico. Tell folks the story that you told me earlier today about, in the immediate aftermath, there was a report about the Oaxaca Dam being in jeopardy of collapsing. Right. And we knew that if that happened, there was more than 100,000 people who could be in danger. Tell people about your attempt to get there.
Yeah, so it just materializes or crystallizes what was going on in Puerto Rico. We didn't have communication over here, right? For a lot of the time, your reports was getting out to the people in the mainland and to some spots of the island. So when we were in the metropolitan area, we got word that NOAA had established that the Oaxaca Dam, which is a dam.
Right, it was NOAA that first put that out.
Yeah, I remember it was at 2 p.m. Right. I remember vividly, and it was a tweet. We saw that, and then we said, well, how do we tell people at the other side of the island?
And how do you verify it?
Yep.
How do you verify it, and how do you alert folks?
Well, again, in the midst of this disaster, my concern was not verifying it, because it was NOAA. So it was, but my concern was, the downside to this being true is enormous. Sure. It ended up not collapsing, of course, but so
there was significant damage.
There was significant,
and they are still working on that damage. The repairs have not been finalized. Anyway, go back.
So what we decided to, this was about 3 or 4 days after the storm. There was still the storm tail around Puerto Rico, so you couldn't fly to Isabela. You couldn't call them. We didn't have radio contact. So I was sitting down with the resident commissioner, with Jennifer Gonzalez, and we just looked at each other and said, we're just going to have to drive there. So we drove what is typically an hour and a half drive. Took us about 4.5 hours. And we just got there and tried to identify leadership. There was no communication. They didn't know anything that was going on. And eventually, by word of mouth, we got hold of the mayor, because he was in some shelter up in the mountains. And we told him, we gave him a sat phone, and we said, listen, we should move the people that are closest from the dam away, and this could potentially impact, which was what was being said, about 70,000 folks. Luckily, they intervened in time, and the structural damage, at least right now, There's significant improvements there, but at that point, we had no other alternative.
And I asked the governor to tell that story only because, listen, our friends who live in Puerto Rico and went through this or followed our coverage remember it. But, it's worth noting. I mean, look, the government is easy to blame, and the governor has acknowledged there's some blame that is here that he needs to accept. But you also have to remember there was no power, there was no water, 911 was down, ambulances couldn't get to where they want to go, hospitals were in crisis, doctors were operating in sweat, people were dying because they didn't have oxygen, and you couldn't reach a single mayor on the island. Yep. Now listen, as a journalist, one of the things I thought when I heard that was, how the heck could you not have some other way of communicating?
Yep.
But then I thought, well, what would be another way of communicating? A satellite phone? Yep. And I don't know that even every mayor
they didn't have them.
The states would have a satellite phone.
Right, they did, and over here, and now we have them. That's one of the mitigating. But even mayors that had the sat phones, it didn't work all of the time. So they were truly limited by it. And here's the perspective, and I think the main lesson learned. You have to prepare for the absolute worst case scenario. Implicit in everything that we were doing and planning, even prior to both storms, we were saying this is going to be devastating. But there was always an assumption that we were going to have some sort of function, right? That there was going to be some part of the island
something would still work.
Something would work. So, for example, I recall 4 or 5 days prior to the storm saying, "Hey guys, looking at this storm at this juncture, it was a tropical storm coming, getting bigger." It is probably, we're probably going to lose telecoms. So as plan B, we're going to use radio, right? So because the radio is a pretty robust signaling mechanism. Radio went down as well.
So what about, but wait, WAPA was still in the air.
Well, that's what I did.
Okay.
I every time I needed to voice but it's only a one-way communication system.
Right.
So what I would say, I would go to WAPA. I would say to them, anybody that's listening, these are the things. If you have people that can come to the metropolitan area, let us know what's going on. We can start working. If not, we're going to send runners over there. So it was that primitive at that point. So WAPA was the only radio signal. And let me say this: we're talking about. Police radio was down. Everything was down.
911 was shut down.
911. That's right.
The FCC just put out a report last week that said, 911 was down. Yep. You couldn't. Every mayor has a satellite phone.
That is what we're working on. Not only the mayors, but also the emergency management folks to have phone. I don't know right now where they're at with that, but we had at least 50 with sat phones.
A lot of people are reliving emotion with this report. Mm-hmm. I interviewed a young woman today, and I promised her I would tell you her story. Nicole Cordero's mother, Wanda, died in the hospital. Miss Wanda had been in there before the storm made landfall. The hospital lost power. Miss Wanda needed some oxygen. She was in there for pancreatitis, right? Yeah. And she died. And Nicole talks about being in the hospital and the doctors are in sweat and her mother, and her, through her tears, what she said to me was, number one, I want to be heard. And number two, I just want the governor to have the government and all of us better prepared.
Yeah, I agree. And that is my challenge. That is my complete responsibility now. And I am working within government and outside government to do that. It's not easy. We were sort of doing it in government. Our vision when we were coming in was transforming it, recognizing that just the level basis was wrong and we needed to break it open and rebuild it. Same thing we're going to have to do with emergency management. It was the foundations were all wrong. The expectations were all wrong. The assumptions were all wrong. And now we need to better prepare. And I think we have a once-in-a-lifetime opportunity right now to, with some of the federal funds that are coming, to rebuild up to code, to make sure that people are better prepared, to make sure that individuals also have their own emergency plans in place, and to see what things the government can do, but more so than the government, a society as a whole approach, whether it be on the individual, on the community side, on the government perspective, on the federal government's perspective, seeing how everybody does their part so that we're ready for an event like this and that we can respond better.
But you said to me earlier today, if a storm like Maria were to hit today, we would not be better off today.
Yep.
That a year later is surprising.
Well, it might sound surprising, but think about it for a second. The reason why I say that is because some things have improved, but some things are worse. And in the process of transforming our whole infrastructure and everything else, it takes some time, and sometimes it gets worse before it gets better. So, for example, things that have gotten better are protocols. We're now at Cat 5 levels. Number 2, our experience. We know how to respond. Number 3, our commodity distribution mechanisms. Before it was all in San Juan, and it had to go everywhere. Now we've distributed commodities all across the island so that they can respond better. Number 4, we have more emergency generators ready to respond. Number 5, we're pushing the hospitals to maintain their dual generators so that they can have redundancy. So those are positive things moving towards the future. But if a storm hit, in a week, we still have a weak or even weaker energy system than we had before Maria. That's just the plain truth. We still have and again, the telecoms, water depends on that. We still have 60,000 folks without roofs. So all of them,
I forgot about that.
All of them are in worst position.
I have 2 more questions, and you'll hear from one of the Blue Roofs people in our documentary, which airs in September. I want to correct the record for a minute. I said Hector Pesquera misled us. That denotes an intention. I can't prove that he intended to mislead us. But the bottom line is the information he gave us was wrong, and it was consistently wrong. That leads to this question. Is anyone going to be fired in review of how everything was handled now that you've got the GW report? Is someone going to be fired? Well,
everybody is subject to being fired in my administration. I've made plenty of changes. You could see the record.
You have.
And right now there's 2 considerations that of course, I want to deep dive into the report. I think what you have and what I have still it's a little bit of higher level. I want to see if there's more more direct accountability assessments that we can find out from that. So that'll be one critical component of it. And then the second one is the commitment and expectation to make fundamental changes. If those changes don't occur, then people will not be in my administration.
But yes or no? Will people be fired?
Well, they have been fired in the past, and there's likely going to be more changes within the future. But regarding this report, what we have right now is really high level, doesn't link somebody, and if there's a commitment towards changing, that is my primary sort of objective with all of this, making sure that those officials are ready to make changes.
Lastly, it's easy to beat up on government officials. It's easy to lay blame on government. But one thing the report said was that people didn't take things as seriously as maybe they should have or better prepared.
Right.
What can you do? And give me as candid and detailed an answer as possible. What can you do to truly make sure that people here understand what needs to be done to prepare, how soon they need to be prepared? I wonder, like, when you go to sleep at night, you're a politician. I understand some things you say are political, but like, what's the one burning thing in your heart that you're like, I'll be dang, I am not going to repeat this specific thing? Like, is there 1 or 2 things that you're like, what keeps you awake at night when it comes to this study?
To the study, or just to the whole?
Just in general, just the death toll. Like, it's so sad. It's more than Katrina. It's perhaps one of the worst in U.S. history. And I know it's just a number, but these are people.
No, it's not just a number. It's not just a number. Well, many things keep me up at night. I'd have to say that with this, it's just the firm commitment of finding out everything that we can find out that could be done better, and making sure that whatever protocol and mechanism we implement in Puerto Rico is the best in the world. That's just plain and simple. That's what our people deserve. That's what we have the opportunity to do, so that is what keeps me up at night. I always have, as a scientist, you always keep trying to dig deeper. So even with all of these reports, there's always something bothersome. This was devastating. Maria was catastrophic, but what sort of other curveball can come, right? What sort of other different event can we experience? And the answer, the very obvious answer to that one is an earthquake. How do we respond to an earthquake? We haven't experienced that. It's all essentially, in theory. And so one of the things that I've been doing to make sure that we know that hurricanes are coming, but there is a probability that we're in a fault line, so Puerto Rico will get hit by an earthquake. And my concern is that, at least for the time being, getting people prepared for hurricanes is going to be easier now than it was before, right? We really had to make a case for it before saying, this hurricane is coming, it's going to be devastating. But in the past, here's the thing, David, in the past, I would say 4 or 5 hurricanes, literally there were hurricanes that were coming straight to the island, and then last second they would veer off to the north or to the south. And there was sort of this implicit notion. People thought that we were just blessed, and that these things were not really going to go by Puerto Rico, that there was really that hope that things were going to veer off. Now that we got hit, I think that there is there's a palpable experience, and what I'm trying to do is leverage that palpable experience to do 2 things. Number one, getting people ready, as you said. It's not only what government does, it's what every individual does as their individual emergency response plan. It is critical for folks to have that, because you can do 80% more than what we can do just by knowing that you're going to have 10-day supply of water, knowing what to do in case of a storm hits, and so forth, how to respond, how to communicate, and so forth. But what I'm trying to really capture, and I don't think I've been very successful at that, is trying to get into folks' imaginations that, hey, this is not only a hurricane, an earthquake can come as well. And we need to prepare for that event that we still haven't lived, as was the case with Maria, but that can be major, catastrophic, and that we have to think forward to anticipate. So I would say that, again, obviously another event like Maria keeps me up, but since we now have that, we can learn from it and see how we can prepare towards the future. But I am very much concerned about other devastating events that could occur, and top of mind of that would be an earthquake.
A lot of people are relying on you, sir.
Well, and I am, I know my responsibility. I am grateful for the opportunity that I was given. Many folks say that under the circumstances, the fiscal and economic crisis we inherited, and the obviously the hurricane and so forth, had you known that this was the case, would you have done it?
Would you have done what?
Would I have been governor? And the answer to that question is unequivocally yes.